Chalo, yeah.
Yeah, starting. Hello everyone. So today we are with our next episode of Soch Naadan Zindagi Ke Liye. So basically, as you all are aware, we are working towards the better psychological health of kids who are the future and the youth of tomorrow. And we are always talking about their correct upbringing. So recently we have started with this series. We have already talked about anxiety, and today I have an amazing person, a talker, and a really good psychiatrist with me, Dr. Samir Shah from Mulund, Mumbai, who is going to tell us about depression. So here he is. Sir, will you introduce yourself a bit more and let us know about you?
Okay, thank you. I am Dr. Samir Shah. I had the privilege of having a 19-year-old daughter and a 14-year-old son. I did my MBBS at JJ Hospital and my psychiatry at KEM. I have been in this field since 25 years, which includes 6 years of working in England as a psychiatrist. Like Parita said, I practice in Mulund. I have a modest private practice. And you obviously know Parita and the brilliant idea which she's had. And this is a much needed topic for the current environment. She was kind enough to include me, and so here I am. Pardon me if I speak a little rapidly because that's one of the signs of anxiety. And also, we are trying to do justice to this topic, but try to keep it short and wrap it up in 40 minutes. So, yeah, Parita, the doctor is ready to be examined by you.
Okay. So I feel whenever it's about Indian parents, when we talk to them, okay, when a child goes and approaches to his or her parent about mental illness, that he or she is not feeling well, or whatever inside mechanical locha that is going inside them in their head, parents are not able to understand. So can you just brief about what is actually mental illness? What is the different thing about it? Like why it is necessary to be focused on?
Okay. Now, physical illness, we all know malaria, diabetes, pneumonia.
Yeah.
ब्रेन भी लोगों को समझता है कि you have sometimes people come confused to me with illness of the brain and I say भेजा और मन अलग चीज है. The brain and the mind are different things. अगर ब्रेन में तकलीफ हो तो you will have paralysis, fits and such illnesses. मन में तकलीफ हो तो आपको उदासी, चिंता, बार बार हाथ धोते रहना, बंद लिफ्ट में जाने को डर लगना, घबराहट होना, वहम रहना कि कोई मेरे पीछे है, मुझ पे काला जादू कर रहा है, मुझे मारने की कोशिश कर रहा है, कभी कानों में आवाज आना लेकिन दिखता नहीं है कि कौन ये आवाज करता है. तो ये सब मानसिक बीमारियां हैं. These are illnesses of the mind. I'll just elaborate on some peculiarities of the illnesses of the mind, and this is preparing ground for our main topic, which is childhood depression. Now, not too long back, people would feel, even physical illnesses like jaundice and all are karma, uska karma hai. Now we realize infections, kidney stone, ये सब machine है, body की machinery में problem है, and these are things which are causes and can be treated. Mental illness now slowly is coming into that much level of awareness कि ये भूत प्रेत या lack of will power का problem नहीं है, ये भी बीमारी है जिनके कुछ कारण होते हैं और जो ठीक हो सकते हैं. Now, one problem with mental illnesses is they are invisible, अदृश्य है, दिखते नहीं है. अगर यहाँ बहुत बड़ा सूजन हुआ तो सबको दिखते हैं, सब लोग सिंपैथी देते हैं. अपने समाज में कोई मानसिक बीमारी के बारे में बात भी नहीं करता. People will say I got admitted for this, that, but nobody will say I have. There's a lot of stigma attached to it.
Yeah.
Also, we don't have for illnesses of the mind something like an X-ray कि अरे तेरे को डिप्रेशन है या ब्लड टेस्ट लेके तेरे को स्किज़ोफ्रेनिया है, बीपी मशीन से चेक करके बोलो कि तुझे तो मेनिया है. No, what we depend mainly on what the person says and what others who know him well say. Also in our field there are a lot of wrong beliefs still. People are also very resistant and suspicious about our medicines कि दिन भर सुला के रखेगा डॉक्टर, लाइफ लॉन्ग एडिक्शन हो जाएगा, लिवर किडनी खराब हो जाएगा. ऐसा कुछ नहीं होता. There is lots of denial. People will say अरे छोड़ दे ये एंजाइटी ऐसा कुछ नहीं होता है. ये
Agree. Yeah.
Parita, that's like saying तू बाहर आ जा तेरे अस्थमा से, फ्रैक्चर छोड़ दे, तो डेंगू डेंगू क्या कर, it's something like that. सब कुछ विल पावर पे डिपेंडेंट है. So in a way you indirectly stigmatize the person even more कि तू वीक है इसलिए तेरे को ये सब प्रॉब्लम हो रहा है.
Yeah.
Tell me, I am not mad. मैं थोड़ी पागल हूँ.
Agreed.
And what I say is, yeah, tell me.
There is also that funny line, हर पागल बोलता है कि मैं पागल नहीं हूँ. And especially about that depression thing, even if I at this age I go and tell my mom that I am depressed, she will be like अपने friends को छोड़ दे, कल सुबह जल्दी उठ के तो कुछ काम करने लग. Where we are doing everything, okay, but that is what is depression.
सारी गलती तेरी है.
Okay. Yeah.
So when somebody says I am not mad, I say I don't treat mad people. आपको बीमारी है, आप इसे समझ लिए, आप डॉक्टर के पास जाके इलाज कर रहे हो, वो समझदारी की बात है. कोई बीमार है और घर पे बैठ के बैठा कि मुझे कुछ नहीं हुआ है, वो ना समझे की बात है. ऐसे लोगों को मैं जनरली ट्रीट नहीं करता. ऑल्सो मेंटल इलनेसेस दे क्रीप इन इंसीडियसली. समझता नहीं, कभी स्टार्ट हो गया, कभी कभी सडन भी हो सकता है फ्रैक्चर की तरह, लेकिन नॉर्मली बहुत स्लोली आता है. और ये मन की बीमारी है, तो मन चंचल होता है, तो कभी कभी अच्छा लगता है, कभी बहुत खराब लगता है, फिर कुछ देर के लिए अच्छा लगता है, तो पेशेंट एकदम कंफ्यूज हो जाता है कि ये क्या हो रहा है. मेंटल इलनेसेस में इट्स वेरी इंपॉर्टेंट टू नो वी डोंट गो बाय वन सिम्टम. जनरली पूरा सिम्टम का बास्केट होता है, वो हम सब कंसिडर वगैरह करते हैं. बाद में ही हम कहेंगे कि ओके ये मन की बीमारी लगती है.
Agreed. Very true. So today we are going to talk about depression. So can you just tell us what is depression?
Okay. Now every day we feel up and down, angry and frustrated and elated. So that's a part of life. वो हर एक के साथ होता है. लेकिन कभी उदासी जो अप्रोप्रिएट नहीं है टू द सिचुएशन, ज्यादा ही है, बहुत एक्सेसिव है और बहुत देर तक है, मूड लो ही है, तभी हम सोचेंगे ये डिप्रेशन है क्या. नॉट जस्ट अ वन ऑफ टू थिंग. उसकी पर्सनल लाइफ अफेक्ट हो रही है, काम या स्कूल अफेक्ट हो रहा है, सोशल लाइफ अफेक्ट हो रहा है, उस स्टेट ऑफ माइंड के लिए, तभी हम सोचेंगे कि शायद ये डिप्रेशन हो सकता है. आसान शब्दों में डिप्रेशन इज बैटरी इज लो. कुछ करने का मन नहीं होता, किसी बात में इंटरेस्ट नहीं. जो पहले एंजॉय करते थे आजकल उसमें भी कुछ मजा नहीं आ रहा है. आईपीएल देखता था, अभी मन नहीं होता है. कॉन्फिडेंस कम हो गया, मुझसे कुछ नहीं होगा. आदमी गुमसुम हो जाता है, एकदम विड्रॉल, किसी से बात नहीं करता है. या तो लो एनर्जी रहता है, एक जगह पे बैठा रहता है, या रूम में चक्कर मारते रहता है, एकदम रेस्टलेस फील होता है. अपने आप को कुछ नहीं समझते. सेल्फ कॉन्फिडेंस, सेल्फ रिस्पेक्ट एकदम लो होता है. कभी कभी पीपल कम विद कि मेरे को कुछ याद नहीं रहता, कॉन्सेंट्रेशन नहीं होता है, टीवी चालू है लेकिन मेरा दिमाग कहीं और कुछ तो सोच रहा है. पर्सन इज क्वाइट लाइकली नॉट टू बी एबल टू गेट गुड स्लीप. और कभी कभी बहुत सोता है लेकिन कभी फ्रेश फील नहीं होता उसको. इसके बावजूद कभी कभी जबरदस्ती खाना मुंह में ठोसता है, वो भी मन नहीं होता है. कभी कभी ज्यादा खाता है लेकिन फिर भी सेटिस्फाइड फील नहीं होता है. रोने का मन होता है, या तो रोने के रोता रहता है काफी टाइम. सॉरी, दैट वाज जस्ट माय मोबाइल. एट द सेम टाइम बैटरी इज लो, लेकिन कुछ दिमाग की सर्किट चालू ही रहती है. वो खुद को मारते रहता है दिमाग में, मैं ये हूँ, मैं निकम्मा हूँ, मैंने ये जो किया वो गलत किया, ऐसा नहीं करना चाहिए था, ये हमेशा ऐसा ही रहेगा, मैं सब पे बोझ हूँ. समटाइम्स द पेशेंट फील्स डेथ विल बी अ गुड थिंग. कंटाल आ गया. It's a fantasy. It's not necessary that he is suicided, but ऐसे वो सोच के आता है.
Just give up. Like there are no hopes ahead. This is what they think because they are low.
Yes. लगता है यार ये, and because there is hopelessness, they feel ऐसा ही रहने वाला है. It's difficult to convince. Even people who have come to me with repeated episodes, and when they are again low, and I tell them देखो आप हर बार ठीक हो गए, but फिर भी that person finds it difficult to accept.
Agreed.
Depression is severe and prolonged, then suicide can become a real case.
Agreed.
Now another thing is sometimes people come with a lot of physical complaints. ये दुखता है, वो दुखता है, constipation, acidity, headache, घबराहट, द बैटरी इज लो, पूरे मशीन में कहाँ भी प्रॉब्लम होता है, तो अक्सर फिर दूसरे डॉक्टर के यहाँ सब चेकअप होके कोई डॉक्टर बोलता है कि नहीं, दिस लुक्स लाइक डिप्रेशन, एंड देन दे कम टू अस विद अ प्रीटी थिक फाइल. Sometimes a person can't explain क्या हो रहा है, but he just feels very बेचैन and miserable. At such times, you have to understand and give words, give a language to this person for this invisible, vichitra state of mind. Sometimes a person Google करके आया and he understands things logically, but he still cannot help feeling being overpowered by this emotional state of mind.
Agreed. This is where when people are living consciously, still we as adults we at least have 10 to 20% of consciousness in us. And still if we suffer so much, so what about kids? That is why I wanted to talk to you about kids. So like what is a depression in a child, or what are its symptoms you can say, or can a child suffer from depression? That is my question. उनको तो क्या पता कि depression क्या है? Can they?
It's a very relevant and a good question. काफी टाइम मेरे पास पेशेंट्स रिलेटिव्स आते हैं ना वेटिंग रूम में थोड़ी देर बैठकर, एंड दे सी समबडी मच यंगर देन देम, दे विल से अरे उसको भी प्रॉब्लम है, उसको क्या हो सकता है, एंड आई टेल देम कि प्री स्कूल बच्चे को भी बीमारियां हो सकती है. सो children get depressed. Up to 2% of children can have depression. 2% is 2% too much. यानी 30 बच्चों का एक क्लास हो तो यानी 4 क्लास में एक बच्चा, it's very likely he has suffering from depression. Now the symptoms are quite similar जो मैंने आगे बताया, but there are some other specific differences. मैं खाली अभी वो बताता हूँ. In a child, it's quite likely that he'll be more irritated. चिड़चिड़ हर बार किसी बात पे is not calm and शांत. There will be more complaints of stomach ache, headache, जिसके लिए डॉक्टर को इलाज नहीं मिल रहा है. There might not be weight gain which is appropriate for that child's age. या तो what we say there is failure to thrive. वो उसी एज पे अटक गया है, बाकी बच्चे की तरह उसका इंटरेस्ट वगैरह चेंज नहीं हो रहा है, वो लगता है वहीं पे है, he is not thriving. Sometimes such children can be also more clingy, चिपक के रहते हैं, because the fear and confidence is very low. Now also what happens is children, they are not emotionally matured at times to express sadness, so their body will express it. In terms of there will be bedwetting beyond the usual age. There will be nail biting, there will be stammering, there will be hair pulling. They might have something like tics and all. But this is to be taken with caution, because on one hand you have many people who are in denial, on the other hand you have people who are over anxious also. तो ऐसा नहीं कि एक भी चीज सुन के आप भागो डॉक्टर के पास, कह रहे इसको चाइल्डहुड डिप्रेशन है, हमने ऐसा सुना. Like I said, it's a whole basket of symptoms which is taken into consideration. So hyper if you feel मेरे बच्चे को ये है. Bedwetting जैसा many, up to I think 2% of teenagers can also have, so it's okay, don't worry for that. Another thing is बच्चों में डिप्रेशन बाकी चाइल्डहुड बीमारियां, मानसिक बीमारियां के साथ हो सकती है, like ADHD. ADHD is attention deficit hyperactive disorder. अटेंशन डेफिसिट यानी किसी बात पे वो अटेंशन नहीं रख सकता है, उसका अटेंशन यहाँ वॉन्डर होता है. हाइपर एक्टिव यानी एक जगह रह नहीं सकते, बस दौड़ता दौड़ता घूमता रहता है, कुछ ना कुछ चालू रहता है. थिएटर में लेके जाओ मूवी के लिए तो थिएटर में भी चक्कर वक्कर यहाँ वहाँ मारते रहता है. Can be along with autism. Now autism is an illness in which the child is unable to communicate appropriately. वो सोशली लोगों से बात नहीं कर पाता, वो कई बार आई कांटेक्ट नहीं रखता है, उसको थोड़े रिपीटेटिव एक्शन से वो ही करता है, उसके रूटीन चेंज हो गए तो बहुत डिस्टर्ब हो जाता है. कभी कभी ऐसे बैठे बैठे मूवमेंट्स वगैरह चालू रहते हैं. चिल्ड्रन कैन ऑल्सो हैव OCD which is obsessive compulsive disorder. जैसे मैं कह रहा था हाथ धोना वगैरह या बार बार कोई भी चीज चेक करते रहना, तो डिप्रेशन और ये काफी टाइम साथ साथ में.
So, if a child is introvert or not opening up since childhood, so can you take that as depression or no? Or that is just their social environment or something like that?
I
Because
would
if
bully.
yeah, because if you bring a child to a life, so I prefer they are the outcome of whatever they see. Then you cannot blame कि child introvert है, बोल नहीं रहा है. So that is my point is. So is there something कि fear हुआ होगा या बोलने से किसी ने रोका होगा इसलिए वो introvert हुआ या that is just a natural characteristic? That is what I wanted to understand.
It can be the whole spectrum. That's the way
Okay.
the person is. या तो
Okay.
कॉन्फिडेंस वगैरह रहता है या तो देयर कैन इवन बी समथिंग लाइक अपना टंग कैसा ऐसा ऐसा हिलता है बट देन
हाँ.
अटैचमेंट तो कभी अटैचमेंट आगे रहता है तो हिज टंग डजंट मूव मच वो टंग टाइप
Agreed.
है यू हैव टू कट इट तो इफ ही स्पीक्स इट साउंड्स फनी तो उससे अच्छा वो बोलता ही नहीं है या इज फेसिंग अ वेरी क्रिटिकल atmosphere at home. In England, earlier there used to be a saying that children should be seen, not heard.
Agreed.
So, for one symptom, I definitely will not jump on the child and say, "Arey, mera case hai, mera case hai." No, never. I'll have a talk
Agreed.
with the child, I'll have a talk with the parents, see everything, and then come to.
Yeah. Very true. So, what all causes depression in a child?
Now, causes can be inside the child or outside the child.
Yeah.
It could be something as simple as hypothyroid. बच्चों में भी होता है. So,
Okay.
इसके कारण one of the symptoms of it is low mood. Yeah, what we say heavy genetic loading के family history strong है तो उसका genes से predispose करता है.
Agreed.
There can be causes outside the child. घर का atmosphere एकदम hostile है. Family members fight करते हैं, there is violence. There might be a divorce in the family or the child thinks कि divorce होने वाला है. Somebody close to the child has passed away and child से किसी ने बात नहीं किया उसके fears सुना नहीं उसको किसी ने explain नहीं किया that could be a cause shifting home shifting school and your entire network goes that can be a
Yeah.
cause of going low and sometimes children can understand what has happened but they don't have the mental defenses to cope with it that could be a cause. Then there are three types of abuses which can lead to like child is क्या घर पे स्कूल में बिल्डिंग में usually that's a circle
Yeah, Sakar.
तीनों जगह हो सकता है. One like I said emotional abuse घर में over critical adults है उसको शैतान का लेबल ही लगा दिया सब लोग ये पैदा ही हुआ है हमें परेशान कर elders are busy everybody is working उसको कोई सब
Yeah.
लोग इग्नोर करते हैं. And I'll just take a side track, but you might be surprised to know that lack of stimulation can also be a cause of low IQ.
Okay.
Yeah. And coming back to emotional abuse, where take outside frustration on a very easy target. So easy to start shouting and all at them.
Yeah.
Abuse can be physical, that is, he's being bullied.
Yeah.
Bullying, excessive beating, punishment without explanation. क्यों मिल रहा है क्या करना चाहिए क्या नहीं करना चाहिए और क्यों नहीं करना चाहिए. Next is sexual abuse. West has become aware of it. अपने यहाँ धीरे धीरे awareness आ रहा है नहीं तो there's a lot of denial and a sharam and nobody wants to talk about it but just sweep it under the carpet. I'll take a minute on this because like I said it's an important topic. The person, the perpetrator is usually someone known to the child. It can be an uncle in the family, in the building, it can be some school peon, somebody whom the child knows. And these people, they are very clever. They know on whom to pick up on. कि इसको parents ignore करते हैं, ये किसको बोलेगा नहीं, ये डरपोक है. Now, these child abusers, they groom the child. पटाते हैं उसको धीरे धीरे whatever and all and then they play games with the child and the games go on to hiding some toy in their body and telling the child search for the toys and so on.
Yeah.
They may say the child, ये अपना special secret है, किसी को बोलना मत. Yeah, my life is very sad. It is only because of you that I'm happy, or I'll commit suicide. और किसको पता है तो I'll comment kill your mother. So imagine the pressure on the child. एक जगह पे sexual abuse हो रहा है और दूसरी जगह पे he feels the onus of saving his mother's life is on him. So it's very, very, very important to teach every child about good touch, bad touch. Sex education.
Somewhere I feel very happy that we are talking on it and we are creating awareness, because listening all of these things, like in books, fine, sociology, fine, we hear it. But when we discuss it, it is actually giving goosebumps. So, and when some patient would be coming to you and talking regarding all this and handle it, it's very difficult.
Yes. Actually, in UK where I was working, even if an adult comes and says कि मुझे sexual abuse हुआ था, and that person is revealing to me for the first time, I have to contact the services, because that person, wherever he is, the old man, is still going around abusing children. So they have to go and be alert. That's how sensitive and on the problem they are. A very easy thing is, or you can go on YouTube, type in good touch, bad touch, and it's highly likely you will get a video explaining it to you in your language. You can even sit with your child, both of you watch it together. You can talk to that child, explain to the child. So it creates a channel of openness. The child knows, kuch bhi hua to I can go and talk to my parents about it.
Agreed.
Yeah. I'll also share some of the personal experience. Maybe not everything you will agree with. Often parents come and say, "Bacha, बहुत तकलीफ देता है, बहुत तकलीफ देता है." Okay,
Yeah.
I speak to the child alone, and then I speak to the parents. And मुझे कुछ specific मिलता नहीं है. Then I talk to the parents, and I find one of the parent is depressed. उसकी बैटरी है, करके उसे child की चंचलता manage नहीं होती. And it is easy, like I said, to pick on the child and make him the target. So then I have to tell them, this is the situation, and I feel this is what's to be done. I also seen sometimes child is a scapegoat, a bakra of a bad, dysfunctional marital relationship.
Agreed.
Husband and wife don't talk to each other about it. Like
Your voice, I think your screen is lagging a bit.
Yeah, I can.
Yeah.
Okay. How are things now?
Has my computer picked up? I can see you.
Yeah, all good, all good. Yeah.
Sorry, where did you lose me? I was speaking about.
The chat, like parent ka battery low hai. From
Okay,
there it
sorry.
was lagging.
Sorry, so I'll repeat myself. The parent's battery is low, and that's why the parent cannot handle the. Can you hear me? Yeah, the parent cannot handle the chanchalta of the child.
Yeah.
And so it's easy to child ko target karo, usko victim bana do. After that, I was speaking on sometimes the marriage is bad. It's a dysfunctional marital relationship, but the husband and wife don't talk about it. Uske jagah pe bacche ko bakra bana. That's the only topic they will take, and usko they will keep on saying. So at such time you have to tell, problem yahan hai, yahan nahi. Yes, Vanita.
Agreed. And I will tell you my personal psychology. So when I say, like, when I think about future, one day I'll get married, and when I talk about kids, now since that I'm aware about it, so usually people around say वो हो जाता है, बच्चे बड़े हो जाते हैं, धई जैसे. So I belong to a Gujarati family. But then I feel, do you know it's such a huge responsibility? Just education, food is not the main thing. Like psychologically, these days, like our generation is completely outgoing and we have too many things to deal with. And plus, if we'll be that frustrated, what will our child take? So that is what I want to create awareness with.
Yes. Let me add on to that. I'll be coming to this point again. Sometimes it's not the child who has to grow. Sometimes it's we who have to grow.
Yeah, true. Very true. Wonderful sentence.
Thank you.
But okay, and how will we come to know that a child is depressed? Like you already said, like biting, like moving. Are there any specific symptoms only for depression?
I earlier mentioned, like I said, नहीं एक symptom पे you can never go. It's a whole basket. तो जो मैंने adults पे describe किया और फिर बताया child में ये specifically हम अलग देखते हैं, उतना if you pick up ना, तो you will get a pretty good idea. You can also talk to your GP or the parent to talk to the GP or a pediatrician who will also give an idea. And
Okay, so that is how they can go and contact.
yes.
Okay, and what can we do for a child who is suffering from depression?
Yeah. So in management, I'll tell you what happens if you don't treat first. So it's a downward spiral. मैं डिप्रेस्ड हूँ, मैं कुछ काम नहीं कर पा रहा, एग्जाम्स में अच्छा नहीं कर पा रहा, फ्रेंड्स नहीं है, कॉन्फिडेंस लो है, लोग चिढ़ाते हैं, तो मैं और डिप्रेस्ड हो जाता हूँ, और डिप्रेस्ड हो जाता हूँ, ये सब चीज़ और बढ़ती है, तो मैं और डिप्रेस्ड हो जाता हूँ. सो दैट्स व्हाई इट नीड्स टू बी ट्रीटेड. और फाइनली मेरी आइडेंटिटी बन जाती है कि मैं ये हूँ. समटाइम्स आई हैव गॉट adults and history लेते टाइम समझा कि ये बचपन से डिप्रेस्ड है, and I have treated them and they say wonderful, first time I am feeling like this, great. Second time they come happy, oh wow, great doctor, you have really transformed my life, superb. And then they never turn up.
Okay.
So I would feel pretty puzzled कि क्या हो गया. And my theory is उसका आइडेंटिटी था, तो उसका लाइफ उसने स्ट्रक्चर किया, काम वैसा लिया, लाइक अ क्लर्क, चुपचाप किसी से मिलना नहीं, डोमिनेटिंग स्पाउस जो सब कुछ डिसाइड करेगा. और अभी जब एंड द स्टेट ऑफ माइंड, तो सब चेंज हो गया, तो पर्सन बिकेम डिसओरिएंटेड, नॉट कंफर्टेबल. सो इन अ वे डिसाइडेड टू रिवर्ट बैक, कंफर्टेबल इन द नॉलेज कि बहुत ज्यादा हो गया तो ये डॉक्टर के पास जाएंगे और दवा देंगे और इसमें से मैं निकल जाऊंगा. Anyway, sorry, coming back to the child will not fulfill his true potential, which he is capable of. He is likely to get more episodes in the future as he keeps on growing up. So what does one do? Well, what does one do when your child has jaundice or fracture? You go to a professional. So who are the professionals here? It's a psychiatrist or a psychologist, usually known as counselors or therapists. So no, mein farak kya hai?
But am I audible?
Yeah, you are. You are audible.
Yeah. My question is, you said they can directly go to the professional, but when it comes to school psychologist also, parents are like, नहीं मेरे बच्चे को क्या हुआ है, he is completely fine. बच्चे को लगता है कि मेरा friend circle क्या सोचेगा. Then how will you change this mindset? Like, we have professionals for everything, and no doubt this change is coming. But how for a child will you suggest to bring a change? It's okay. Like, how will you say it's okay?
Yeah. So that's a very challenging thing for the school teacher to break the news to a parent. Parents को बुलाओ. Ask them कि घर पे कैसा है, क्या है. Very, very often they have an idea कि कुछ गड़बड़ है. They might be trying to suppress it, but they have an idea. पूछो, आपका फीडबैक दो कि मैंने देखा है कि क्लास में ऐसा 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 है. उनको पूछो कि क्या कर सकते हैं, आपको क्या लगता है. Try to have them suggest the thing. कुछ नहीं तो you can be more softer. Like I said, you can suggest going to a GP or a pediatrician, where they'll get even more as a medical authority बोल रहा है kind of thing.
Agree.
Yeah. Shall I return to what is the difference between a psychiatrist and a psychologist?
Yeah.
Okay. So psychiatrist is a medical doctor.
Yeah, sure. Just mention it.
Yeah. So psychiatrist is a medical doctor. He tends more to treat with medicines. Psychologist, usually known as therapist or counselor, they have done their MA and they do more of talk therapy. So in talk therapy, they'll help, I'm speaking for everybody now, to clarify your thinking, show where you are focusing more, where you are focusing less, what all will suit you, not pranayam or jogging will suit everybody. Your picture is, so accordingly they'll suggest what is more appropriate for you. In children, sometimes they can't express, so there are very nice tests. It's like कभी कभी पिक्चर दिखाते हैं जिसमें थोड़े एनिमल्स होते हैं, पूछते हैं कि आपको क्या लगता है कि क्या हो रहा है और इससे पहले क्या हुआ और इसके बाद क्या होगा. बच्चों बोलेगा ये बेचारे को सब लोग चिढ़ाते रहते हैं, मारते रहते हैं, तो इसके लिए ऐसा है, और बाद में उसको उदास होगा. So then you know, because ultimately the child will be telling his own story.
Agreed.
There will be a
It,
test. Sorry.
child needs to be heard.
Yes, yes.
Yeah.
Sometimes they'll just say draw a house, person and tree, and किस हिसाब से वो draw करता है बच्चा छोटा, घर के अंदर बाहर. From that they interpret के बच्चे के अंदर क्या चल रहा है.
Agreed.
When you go to a psychiatrist, he'll find out, try to what is the cause. Something as simple as hypothyroid, so you just replace the thyroid and you find physically and mentally both the child is picking up. अगर लगता है दवाई की जरूरत है तो दवाई देंगे. So people jump up, अरे इतने छोटे बच्चे को दवाई. Medicines are safe. Even pregnant women with the child inside them can be given, and they're only given when you feel that इससे फायदा होने के chances बहुत ज़्यादा है and नुकसान होने के बहुत कम. Medicines might be given for 6 to 12 months. इसका मतलब ये नहीं कि 6 से 12 बच्चे तक बच्चा डिप्रेस्ड रहेगा, बट दैट की वो तो 1-2 महीने के अंदर ही बहुत फर्क आ जाएगा, लेकिन सो दैट द बैटरी गेट्स फुली चार्ज और फिर से डिप्रेस ना हो, उसके लिए इतने महीने दवाई लेनी पड़ती है.
Yeah. And I, as a teacher, like being into classroom, I can feel that at times teachers are also rude about the kids' psychological issue. अरे ये तो ऐसा ही है, लास्ट बेंच पे बैठा दो, इसके घर पे कुछ होगा, इसको ऐसा करो. They are not taking initiative. So how can a teacher identify at first? So first, if I see a child not writing complete answer or going wrong with spellings, I will say beta write, beta write. She is teacher. She will say उसको क्या फर्क पड़ता है? This is the psychology of educational system. मेरा बेटा थोड़ी है. But then why are you into this profession? This is what my statement is always. So how can a teacher identify and how can a teacher take the thing to a parent, or what can she do?
Okay. I'll just come from a different point. A very wise counselor from the UK once emailed me, hurt people hurt. Mala, what do you mean? It's like kill people kill. No. What she described was, person who is hurting inside, he is the one who goes around hurting everyone. So it's hurt people hurt. So बच्चा जो सबको disturb कर रहा है, don't go by the face of it. Try to find out what is the reason behind it. You can apply the same to kids. Disturb children, disturb.
Yeah.
Like I said, those symptoms पहले, child is too quiet and withdrawn. उसको personally पूछो तो answer बताएगा, लेकिन ऐसा पूछो class में किसको answer मालूम है, raise your hand, तो नहीं करेगा. रोना बहुत जल्दी आ जाता है, सारे class उसको चिढ़ाते हैं. So you can think there seems to be something here. For a teacher, I would also advise take the head teacher into the loop. Then I earlier discussed about how do you talk to the parents and break the news.
Yeah.
And if you have to sell the idea of a psychologist or a psychiatrist, one good point always is, क्या जाएगा ज़्यादा से ज़्यादा, consulting fees जाएगा, जाके सुन के आओ. अगर वो बोला कुछ नहीं है तो you will be relieved. अगर वो बोला कुछ है तो शायद एक प्रॉब्लम जो और बड़ा प्रॉब्लम हो सकता है सॉल्व हो जाओ. कि सुन के आने में क्या है, psychiatrists won't start shoving medicines down your child throats as soon as you enter the consulting room. Teacher can keep on once if a child takes professional help, keep in touch with the parent. क्या हो रहा है, कैसा हो रहा है. You can send your observations maybe even once a month to the psychiatrist or psychologist in a sealed envelope. You would welcome data from you कि no change better, अभी थोड़ा smile करता है, अभी लोगों से बात करता है. The power of a teacher is immense. I remember every compliment or good thing a teacher told to me in school. Unfortunately, there were not too many. I also remember any scolding or criticism any teacher gave to me. Fortunately, there were also few.
Okay.
You can, when you know a child is low, you can give authentic compliments to the child. Yeah. When a teacher looks up to a child, you'll find the whole class starts doing so.
Yeah, agreed. Very true.
In the child's notebook, you can, कुछ अच्छा किया, you can write it to him. It's a permanent piece of record which he'll treasure.
Yeah. It encourages them.
Yes, like anything. And keep confidentiality if the child is going to a professional. I also have
Yeah.
an idea. I hope somebody picks it up. I feel the class teacher should spend 10 minutes every day talking to just one child. Just personal
Okay.
chatting, no hidden agenda.
Yeah.
So ऐसे किए तो 30 बच्चों के क्लास में टीचर will speak to every child at least 5-6 times.
Yeah.
And believe me, उसको हाइड्रोजन पेरोक्साइड कैल्शियम फॉस्फेट का रिएक्शन सिन थीटा कॉस थीटा प्रेजेंट पार्टस प्रेजेंट ब्ला 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 प्रेजेंट जो भी है
Past
कंटिन्यूअस
year
टेंस
सब आ जाएगा.
आ जाएगा. मैं बोल
Agreed.
रहा हूँ वो सब याद रखेगा कि टीचर मेरे साथ बात करती थी. बरसों बाद जब आपको रास्ते में मिलेगा, that's what he'll remember. He won't remember the history का dates or capital of
Nothing.
Yugoslavia, but he'll remember. This teacher made
Yeah.
me feel good.
But that push, that positivity, and that smile, trust me, that even in turn gives us immense love. Huh? It's not only
Yes,
what they get, it's something that
yes,
even I get in turn. So I
yes,
feel on top
yes,
of the world.
yes. When you
Yeah,
give, it's invariable that you will get.
agreed. True.
What you give,
So,
you get.
yeah, very true. So, you would like to say something to sum up this whole topic?
I just wanted to add some final thoughts. Are we
Yeah,
just
sure.
having 4 minutes?
No, no, no. We have time.
Oh,
Yeah,
okay. So, a child is not a trophy to wave before society.
yeah,
If you catch yourself doing that, work on yourself.
yeah,
Why I'm using the child as a substitute? मेरे बच्चे को इतना आया, ये कर रहा है, वो कर रहा है, इधर फर्स्ट, इधर 80%, blah blah blah. Second, when I began my practice, one of the advice I would give to parents was, live your own life as completely as possible.
yeah.
The child will pick up. I think Tabi, I was a little blasé, a little casual in saying such things. Obviously, it's not so easy. But still, I would see the parent थोड़ा खिल उठता था कि उसे परमिशन मिल रही है, आप खुद के लिए भी कुछ करिए. चाइल्ड मिशन नहीं है कि 24 घंटा उसके लिए ये करो वो करो वगैरह. खुद के लिए भी जीना है. When the mother is happy and content, so is the whole house. This is a quiet hint to the fathers. I think this is very important. Enjoy with your child every day for some time. Just enjoy. No hidden agenda. No सिखाने का छुपा agenda. Child को समझ जाएगा. Just enjoy with your child. Children grow up so fast. We can't appreciate it enough. मैं अभी भी मेरे 1-2 साल पुराने फोटोज देखता हूँ बच्चे क्या ऐसे हो माय गॉड they have grown up so much so fast. This is again my own thought. Children are born complete. They are born complete. अब 2-3 साल के बच्चे को देखो कितना खुश है, कितना क्यूरियस है. See how straight he walks. वैसा हंच चलता नहीं है कि सब लोग मेरे से डबल टिबल हाइट में और मैं इतना छोटू सा हूँ. See how he'll be outraged, if somebody violates his dignity. You and me were also like that. What happened along the way? Think on that. And when you're thinking और आपका आंसर आप देख रहे हो चेंज होते जा रहा है, धीरे धीरे डीपर होते जा रहा है, वाइडर होते जा रहा है, तो probably you're thinking on the right line. Parenting like life is going to be at times frustrating. हम लोग सब पहली बार कर रहे हैं and we are learning along the way. आपके पास एक से ज्यादा बच्चा हो तो भी each child is different.
Yeah.
And you are at a different stage of life when each child was born and is growing up. Don't expect the child to come up to your level. You have to go to the level of the child. Be open-minded, learn from wherever. The world is changing very rapidly. And I'll repeat again, sometimes it's not the child who has to grow, it's we who have to grow.
Yeah.
Doctors, another thing I would like to share with the parents, there's a book in English, translation hoga to pata nahi. It's Dr. Spock's Baby and Child Care. एशियन एडिशन भी मिलता है, अराउंड 400 रुपए में ऑनलाइन आप मंगवा सकते हो. तो वेरी हेल्पफुल बुक. इट्स अ फैट बुक. Don't be turned off by that because it covers all the issues that can come with a child at different ages. You can keep that as a handbook and refer to it from time to time. I would also like it if interested parents can download Khalil Gibran ki ek poem hai Children. Just you can download it and read it. After saying and doing so much buck and giving so much gyan, there's a disclaimer. I tend not to take child patients. I may see children with depression, may or may not. Sometimes parents bring the children and tell me, डांटो इसको. It's like पुराने जमाने का principal के जैसा, डांटो इसको. I don't get into that, pressurized into playing that role. वो लड़के से बात करती है. ऐसे देखो आपका मेरा माइंड सेट डिफरेंट है and I refer them to
stereotypical behavior, all that is.
I just say कि देखो आपका मेरा सोच अलग है, तो I send them back to the person who was referred and speak with that person कि हमारा match बराबर नहीं है. Sometimes when I find बच्चे को कुछ नहीं है, parent को treatment की ज़रूरत है, they often never follow up and all. And psychiatrists don't ठीक है, but I'm also a member of the human race and I feel very sad thinking कि what's the future of the child. And one important point I forgot, whether you go to any psychiatrist, psychologist, counselor, whatever, make sure you feel comfortable and safe with that person. अगर आप बोलने को ही डर रहे हो तो साइकियाट्री जैसा साइकोलॉजी माइंड इलनेस के फील्ड में क्या होगा. इट्स नॉट कि किसी में कुछ रॉन्ग है कोई साइकोलॉजिस्ट से साइकियाट्रिस्ट में. इट्स अ मैटर ऑफ द राइट फिट. किसी के साथ हमारा अच्छा जमता है, किसी के साथ नहीं जमता है. सो there's nothing wrong in that. I think I have covered all the points I can think of. आपको कुछ पूछना है परिता?
Yeah, just randomly one suggestion. Before that question, I would like to say, I always get this thing whenever I talk to parents or anyone, they say कि बात करना is easy, बातों में सब हो जाते हैं, but to implement in real is not easy. Then parents start feeling depressing, they cannot do their way. So what can a parent do at that time? What is your say for this statement? Like everyone says કે વાતો કરવી in Gujarati they say વાતો કરવી બહુ easy છે પણ જ્યારે કરવાનું આવે it's not easy. That time what will you say on this statement?
Yeah. So one thing is agree with them.
Yeah.
Second thing is make sure you haven't put them on a guilt trip.
Yeah.
You might not have, it might be their own circuit to start ho gaya.
Yeah.
Try to understand their situation, their pressures, family members, extended family hai, to ye problem hai. Understand and tell them you agree with them totally, Sometimes that itself cools them down. And like I say, it's often easy to make them say it rather than say it ke you should go jogging for an hour or you should do this. Ask them कि आपको क्या लगता है, क्या हो सकता है, क्या possible है. And I often use words like I would invite you to this suggestion. This is just like you shouldn't force it on them. You should just put it on the table and leave. It's up to them to take it or reject it. And you should not fall in love with your ideas. It's their call. What we can do is suggest. In my field, unless a person is likely to be committing suicide, harm himself or others, I never insist on treatment. It's their choice. Because sometimes mentality is modern medicine, allopathy, kabhi nahi. Psychiatry medicines to kabhi nahi. I say it's fine, your choice. I give them the options and it's totally up to them.
And besides depression, one message you would like to give parents, like one message.
Okay. I'll just repeat what I said earlier. Spend some time enjoying with your child every day. Just enjoy. No hidden agenda. Just मिलके मस्ती करो बस. और देखेंगे बाकी बहुत सारे फर्क अपने आप आ रहे हैं. आपको ज्यादा बोलने की जरूरत नहीं पड़ रहा है. बच्चा खुश होता है बातें हो घर पे तो. What more do you want? Child smiles as soon as he sees you. And you smile as well because both of you are going to have a good time.
Agree. But I must say, few lines and few words were so much on point, and that they used, like you used it. It was amazing talking to you. Like information apni jagah pe, but to reach the crowd and use those lines and explain it. It was amazing session having you here.
Thank you so much, Parita, and the listeners for allowing me the kindness of sharing my thoughts. I hope I have been worthy of your time. If you like that line, it's from a movie. मैंने चुराया ये line. I think movie का नाम था Talk Show or something. I found it a very
Okay.
good line. I hope I
Yeah.
have been worthy of your time. I mean it. I hope you
Yeah.
teachers have an even more fulfilling experience in your extremely noble profession. I hope parents have an enriching, enjoyable parenthood, and I hope your child has a happy, healthy childhood. Thank you again.
Thank you so much. Thank you.
Welcome.
Yeah. Fine. It was happy to have you here. Yeah. Thank
Okay.
you.
Thank you.
Yeah.
Bye.
Yeah. Bye.